Welcome to our webinar, Introduction to Our Services. What should you look for in a billing service? You want a billing service that provides prompt claim submissions. We guarantee that claims are submitted by the next business day at the latest. You also want a billing service that provides accurate claim submissions. You want a billing service that communicates with you about any issues or problems with claims. You want a billing service that has knowledge of your practice specialty and that also has reasonable fees. Now, these are the specialties that we serve, primarily behavioral health, chiropractic, physical therapy, family practice, geriatrics, and pediatrics. Not all practices require the same level of service with medical billing professionals. Providers should only pay for those services that they need. Therefore, we offer three different levels of service: Platinum, Premium Plus, and Premium service. For the Platinum service, it includes prompt claim submissions. We will post all insurance and patient payments in our Medisoft software. If you are using Therapy Notes or Sessions Health, we can submit claims and post all payments in your EHR. We will verify insurance eligibility and benefits for any new patients or for patients who change insurance. It's important to note we do offer an optional verification service for existing patients with the same insurance. For example, you may want to know if a patient's benefits have changed during a new calendar year, or if a patient has met their deductible or out-of-pocket max for the year. This optional service is $11.95 per verification. We also provide follow-up of outstanding primary insurance claims and claims that deny in error for claims that we have submitted. We also can track any authorizations and provide you a detailed claim submission report. This level of service is only available for behavioral or mental health practices. For any other specialty, such as chiropractic or physical therapy, you will want to enroll for the Premium Plus service. So for the Premium Plus service, it includes the prompt claim submission, posting all insurance and patient payments in our Medisoft software, providing the detailed claim submission report. We also provide you a detailed primary insurance aging report showing open claims that were submitted at least 30 days ago. Verification of insurance benefits is optional under the Premium Plus service. In addition, authorization tracking is optional, and follow-up service is on demand. You complete a simple form on our website requesting what claims you want us to follow up upon. For the Premium Plus service, it includes the prompt claim submission, the detailed claim submission report, authorization tracking is optional, verification of benefits is optional. This level of service is designed for practices that are out of network with all payers. Insurance payment posting is not included, and follow-up of outstanding or denied claims is not available. This is a sample primary claim submission report generated from our Medisoft software. And if you are enrolled for the Premium Plus service, this is a sample primary insurance aging report that will be provided to you, broken down by payer, then by claim with all required information on the report so you can easily follow up on claims yourself. For the Platinum service, the standard per claim rate is $3.99 per claim, with a minimum fee of $199.95 per month. If you submit 20 or more claims per week on average, you can consider a 1,000 claim annual prepayment option for $3.65 per claim. If you submit 40 or more claims per week on average, you can consider a 2,000 claim annual prepayment option for only $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. Now remember, we do offer an optional verification service for existing patients with the same insurance. For example, you may want to know if a patient's benefits have changed during a new calendar year, or if a patient has met their deductible or out-of-pocket max for the year. This optional service is $11.95 per verification. There is no fee, remember, for insurance verifications for new patients or for patients who change insurance, with a limit of 60 such requests during a billing month. If you exceed 60 requests during a billing month For new patients or patients who change insurance, there is a fee of $11.95 per each additional verification. There also is no setup fee for the Platinum service. For the Premium Plus service, the standard rate is $2.89 per claim with a minimum fee of $99.95 per month. A 1,000 claim annual prepayment option is $2.59 per claim. A 2,500 claim annual prepayment option is $2.19 per claim. Again, with an annual prepayment option, the number of claims purchased must be used within 1 year. On-demand follow-up service. It's $12.95 per claim that you request we follow up upon. Verification of benefits is optional, $11.95 per verification. Again, no setup fee. For the premium service, the standard rate is $2.45 per claim with a minimum fee of $69.95 per month. A 1,000 claim annual prepayment option is $2.15 per claim. A 2,500 claim annual prepayment option is $1.75 per claim. Again, with the annual prepayment option, the number of claims purchased must be used within 1 year, and there is no setup fee. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. So, if you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum service standard rate. If your average reimbursement per visit is more than $80, your savings by using MBPros is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging a percentage, compared to a maximum of $3.99 per claim with MBPros. If you group your visits together by patient, you can save. For example, let's say on our billing form, you submit visits for John Smith for April 1st and April 8th, and you submit those grouped together on April 15th. Let's also assume you are reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits. If you are enrolled for a Platinum service, you would be paying a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid. In reality, follow-up is needed on only 2 to 5% of claims, depending upon your specialty. If you submit 100 claims during the month, you would be overpaying on the 95 to 98 claims that are processed without any need for follow-up. And to show you how much you can save, you can go to our site, mbpros.com/save, where we have an interactive form so you can calculate how much you can save by switching to us. Now, how do you submit billing to us? Most practices submit patient information and billing via our secure online forms on our website. For providers using one of our preferred EHR partners, we can obtain patient demographics and billing from the EHR. If you are using therapy notes, watch our on-demand webinar, Need Help Billing and Therapy Notes. In that webinar, we explain our services with billing inside of therapy notes. We also can submit billing inside of Sessions Health EHR. If you are using any other EHR, most programs will allow you to print a report of patient demographics and print a billing report, providing us the required information. We do have an introductory special offer. If you want to register for our Premium Plus or Platinum service standard rate, you will receive 1 month free with a limit of 100 free claims. Then just pay our standard per claim rate and save compared to a billing service charging a percentage. So again, you pay $2.89 per claim for the Premium Plus service after the first month free, and you pay $3.99 per claim for the Platinum service, again with the first month free. There is the minimum fee that does apply after the first month free for each level of service. You can prepay and save. you can purchase an annual prepayment option and receive 2 months free and save up to 20%. If you choose the Premium Plus service and purchase a 1,000 claim prepayment option, you can save 10% off the regular annual prepayment option purchase and pay only $2.33 per claim. If you purchase a 2,500 claim prepayment purchase, you will save 20% off the regular prepayment purchase price. You'll pay only $1.75 per claim. With the Platinum service, again, you'll save 10% off the purchase of a 1,000 claim prepayment. It's only $3.29 per claim. If you purchase a 2,000 claim prepayment purchase, it's only $2.68 per claim. This savings of either 10% or 20% applies to your introductory initial prepayment purchase only. The 1-year time period for using the number of claims purchased begins after the 2 months free. This special does expire December 31st. Now, if you're not using Therapy Notes or Sessions Health, we will be submitting claims via the ClaimMD Clearinghouse. We provide you the opportunity to access the ClaimMD portal to view all claims submitted by us, view ERA files, electronic EOBs. When searching for a claim, if the claim was paid by ERA, you will see the corresponding payment for that claim, and you can run eligibility and benefit requests yourself for your patient. Now, ClaimMD will bill you directly for the plan that you choose. They offer 3 options: unlimited, small volume, or basic. For detailed ClaimMD pricing, visit claim.md/pricing. If you're enrolled for a Premium Plus or Premium service and you do not want access to claims and ERAs, you can choose the No Portal option. There is a fee for that if you do not want to choose a ClaimMD option. That does conclude this webinar. Again, for our special, our introductory special, visit mbpros.com/2025 special. You can email us at info@mbpros.com. You can call us at 877-762-7767. We do have more than 40 references available on our website. Go to mbpros.com/references, where you can see references you can contact, most of whom have provided written testimonials. There is no long-term contract to sign. Remember, you can calculate your savings by switching to us by going to mbpros.com/save. And finally, if you want to meet with us virtually one-on-one, pressure-free, just go to mbpros.com/virtual to schedule your meeting. Thank you for attending this on-demand webinar.